Now, as we move into the structure of these arteries and veins that we have, what we're going to find is that the arteries and the veins are going to have tunics. They're going to have 3 tunics. We'll have a tunica intima, tunica media, tunica externa. Think of outside, middle, inside for these tunics. When we begin to look at their structure, on this inner portion, we're going to find that endothelium. It will have some basement membrane. It'll have some connective tissue. We'll have the fenestrals if they're present. As we move into the middle portion is where we're going to have our smooth muscle. And the smooth muscle cells, they're going to be circular around the internal tunic. And the smooth muscle is the reason that we can have either vasoconstriction or vasodilation, meaning it squeezes it shut or it opens it up. On the outer portion that we're going to find for the external portion, note they're trying to show that even though the artery and the vein is for blood flow, we have to have a blood flow to the artery or the vein itself. We also have to have a nerve supply. So there will be a nerve supply leading to that artery or vein, and we'll also have a blood supply servicing the tissues that make up this artery or vein. When we look at the blood supply, this is termed vaso or vasa vasorum. That simply means that this is the blood supply giving blood to the makeup of that vessel wall. If we look at a cross section of an artery and a vein, as they're showing here in this picture, they're showing over here an artery. And of course, this would be the little bit of the blood that's going to be found in there. And they're trying to show us the tunica in the middle, on the internal and the external part. But look over here at the vein. The vein, what we're going to learn is that the veins have the ability to collapse, meaning they're not going to have a very tough structure like we see in the arteries, because the veins are going to be for the blood return back to the heart, and we're going to find that there's going to be some valves located in the veins that help with the blood flow. And veins are going to depend on muscle, skeletal muscle contraction to move the blood through those vessels. So as we look at those types of arteries, like the elastic, the muscular, and if we look at the one that's the elastic artery, these are also termed conducting arteries. They are under extreme pressure. They have a very large diameter. The pressure will fluctuate between systolic and diastolic. They will have a lot of elastic tissue because they need to be able to expand and recoil with the pressure that's going to be going through them. Think about your aorta leaving the heart. The aorta leaving the heart is a very huge elastic artery, and it can withstand those pressures because it has that elastic tissue, and it can change with the beating of the heart. In the muscular artery, we begin to have them move into what is termed the medium size. The smooth muscle that's going to be found in this artery will help regulate the blood supply. It will send it to the tissues of the body. Because it can do this, muscular arteries are known as distributing arteries, because the smooth muscle will actually control the flow to different areas of the body. So we're going to find that we go from having elastic arteries to the muscular arteries. So we go from large to medium until we get to small arteries, which are going to be those arterioles that I showed in the earlier picture, and they're transporting the blood into the capillaries. And at this point, even though tunics will be present, those arterioles, they are at a very small area, and they're going to get even smaller. So the structure of them becomes thinner. So that makeup of those arterioles and then into the met arteriole of that capillary bed, their structure is very thin at this point. Basically, it's that structure of the simple squamous epithelium. Now, once we have the blood flow from the arteries from the large to the medium to the small to the extra small, we're going to have the arteries meet the veins in that capillary bed, and the flow actually goes from small to large. So in that capillary network, we're going to have the blood move into the venules. From the venules, we'll move into small veins. And the small veins, the tunics at this point, when we begin to look at the veins, the tunics begin to get thinner, because we saw very clearly in the previous picture that the arteries have a nice huge diameter, but the veins can begin to collapse. So as we go from small to a small vein, I guess we could say extra small to small, we move into medium and then into large veins. Medium veins are simply the go-between. They are allowing for the connection from that small to the large. When we get into the large veins, once again, tunics are going to be rather thin, okay, but they're more prevalent than they are in the other veins. And at this point, when we get into the large vein, we're having to get a good supply, a good amount of blood back to the heart. Now, the veins are not under any pressure. At this point, the pressure in the veins is almost zero, and it should be very close to zero. So how do we get the blood flow back to the heart? In the structure of the veins, there's an infolding that begins to occur from that internal layer of the tissues. And these are going to create valves. And the valves in the veins, as the blood gets pushed upward and upward into the, like from the lower body into the heart, as we move And see, that becomes important, okay? Because the flow of blood through the veins is really dependent upon skeletal muscle. So the more movement we make, the better we can push on these veins, and when we create the pressure, that'll push the blood up. The vein valves will close. It'll continue to push the blood up to the next area. Valves will close, and we end up creating this skeletal muscle pump to help return the blood to the heart. Now, other vessels that we have in the body, well, I already mentioned the vasa vasorum, those small vessels that are supplying the walls, the makeup, the tissues of our arteries and veins. If you remember, when we covered our chapter on the endocrine system, we were introduced to something called a portal vein, because we had the hypothalamo-hypophyseal portal system. A portal system, this, if you remember, we had a primary capillary network. It had a little bit of distance, went into a secondary capillary network, and then would exit the tissues. And if you remember, I said there were two areas that we have portal veins. One, of course, being the hypothalamo-hypophyseal portal. We also are going to find a hepatic portal vein system. This is where capillaries in the GI tract and the spleen, okay, basically blood from those capillaries are going to go into the sinusoids of the liver. So that's going to be known as the hepatic, because hepatic means liver. So that's going to be the hepatic portal system. Something else that I pointed out in the structure of those vessels, I pointed out that there was a nerve supply. And we have the nerve supply to those blood vessels. For the most part, those vessels are innervated by the sympathetic nerve fibers. The fibers will branch to form a plexus. If you remember what a plexus is, that's a grouping of the nerve fibers in the adventitia, some of that structure of the vessels. And they're going to be able to release a neurotransmitter so that it will connect to the smooth muscle cells. The sympathetic stimulation is going to help the blood vessels constrict if it's from the sympathetic system. If it's a parasympathetic fiber, the parasympathetic are going to cause dilation. The parasympathetic fibers into a blood vessel are found only in the penis and the clitoris. So what we're going to see is that this blood vessel, okay, with the parasympathetic, when it's because, in the penis and the clitoris, there is no sympathetic. So parasympathetic is the only thing that's innervating the penis and the clitoris, and that's because it's to help, it's once again a primitive function, because its job is to help with making sure we reproduce the species, and having the blood supply there will allow for the erection to occur, and with the sexual stimulation, you have a better chance of procreating the species. As we look at what's going to take place, we do find that as we get older, We do have what's called the aging of the arteries. And you'll sometimes hear these terms, arteriosclerosis and atherosclerosis. They're different. Athero is where we have deposition of plaque. Arteriosclerosis is where there's degenerative changes and the tissues break down and the arteries are not as elastic. The blood circulation that we get in these vessels, there's an interrelationship between the pressure, the flow, the resistance, and the control mechanisms. And this is a huge dynamic system because it's almost equal, or if you think about water flowing through the pipes of a house, we need to have the blood flowing through the pipes of our system. And a lot of these factors that create this really excellent dynamic, those are actually going to be very clinically significant about blood flow in areas of the body. A lot of times with our blood pressure in the systems, in the vessels, what's being done is you're measuring the force that gets exerted by the blood on the walls of those vessels. The movement occurs because the heart is a pump, and when it beats, it creates that blood flow through those vessels, those arteries. So we usually measure it using what we think of as the blood pressure cuff, where we put it around the arm. And blood pressure is measured in terms of millimeters of mercury. For example, if we think about a blood pressure of 120/80, well, that 120 means 120 millimeters of mercury. Now, if you know anything about mercury, mercury is a heavy metal. And what this is saying is that the pressure that is being tested, basically the blood flow into that aorta from the heart, could move the mercury 100 millimeters in a column. Now, when we do blood pressure and we're using the blood pressure cuff, what begins to happen is it's measured using and we listen for Korotkov sounds, which is the pressure, the turbulence of the flow in those vessels.